Welcome to this video where we'll be diving deep into vestibular paroxysmia, a fascinating and often underdiagnosed condition affecting balance and vision. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Let's get started. The exact cause of vestibular paroxysmia is often debated, but the leading theory points to vascular compression of the vestibulocochlear nerve, also known as the eighth cranial nerve. This nerve is responsible for transmitting signals related to both hearing and balance from the inner ear to the brain. When a blood vessel, usually an artery, pulsates and presses against this nerve, it can cause the nerve to misfire, leading to the symptoms we'll discuss. Less frequently, tumors or cysts can also cause compression, though this is less common. Think of the vestibulocochlear nerve as an electrical cable carrying information. When a blood vessel presses on it, it's like a short circuit, causing erratic and inappropriate signals to be sent to the brain. These signals are misinterpreted as movement or imbalance, resulting in brief episodes of vertigo, oscillopsia, that is, the illusion of objects moving, and other related symptoms. This compression disrupts the normal firing pattern of the nerve, triggering these paroxysmal, or sudden, attacks. Vestibular paroxysmia is considered a rare condition, and its exact prevalence is unknown. It's often misdiagnosed as other vestibular disorders like Meniere's disease or benign paroxysmal positional vertigo, or BPPV. It tends to affect adults more often, typically between the ages of 40 and 60, but it can occur in younger individuals as well. Because it's often missed or misdiagnosed, the true number of people living with vestibular paroxysmia may be higher than currently estimated. The hallmark of vestibular paroxysmia is brief, frequent episodes of vertigo, often lasting seconds to minutes. These attacks can be triggered by head movements, loud noises, or even changes in body position. Another common symptom is oscillopsia, which is the sensation that the world is bouncing or moving when it isn't. Some individuals may also experience tinnitus, which is a ringing or buzzing in the ears, hearing loss, nausea, and imbalance. The key is the brief and repetitive nature of these symptoms. Diagnosing vestibular paroxysmia can be challenging due to its similarities with other vestibular disorders. A thorough neurological exam is essential, including tests of balance and eye movements. An MRI of the brain with specific sequences to visualize the cranial nerves, particularly the vestibulocochlear nerve, is crucial to look for vascular compression. Additionally, an audiogram is often performed to assess hearing. Vestibular evoked myogenic potentials, or VMPs, and video head impulse testing, or VIT, can also provide supportive evidence. A positive response to medication, specifically carbamazepine or oxcarbazepine, can also be used to support the diagnosis, as these medications are known to stabilize nerve firing. While vestibular paroxysmia doesn't have distinct subtypes in the traditional sense, it's important to differentiate it based on the presence or absence of hearing loss. Some individuals may experience vestibular symptoms alone, while others may have both vestibular and auditory symptoms. The specific location of the vascular compression on the vestibulocochlear nerve can influence whether hearing is affected. So, it can be thought of as presenting with or without auditory symptoms. The primary treatment for vestibular paroxysmia involves medications to stabilize nerve activity. Carbamazepine and oxcarbazepine, which are anticonvulsant drugs, are the most commonly used. These medications work by reducing the hyperexcitability of the vestibulocochlear nerve, thereby decreasing the frequency and severity of attacks. In cases where medication is ineffective or poorly tolerated, microvascular decompression surgery may be considered. This surgical procedure involves carefully moving the blood vessel away from the vestibulocochlear nerve to relieve the compression. Vestibular rehabilitation therapy can also be helpful in some cases to improve balance and reduce the impact of dizziness. Currently, there are no known preventative measures for vestibular paroxysmia, as the underlying cause, vascular compression, is often related to natural age, related changes in blood vessels. However, maintaining a healthy lifestyle, including managing blood pressure and cholesterol levels, may contribute to overall vascular health and potentially reduce the risk of vascular compression in some individuals. Regular exercise and a balanced diet are always beneficial. The prognosis for vestibular paroxysmia is generally good with appropriate treatment. Most individuals experience significant improvement in their symptoms with medication. Microvascular decompression surgery has also been shown to be effective in many cases. While the condition may require long-term management, it's usually possible to control the symptoms and improve quality of life. Recent research is focused on improving diagnostic accuracy and identifying biomarkers that can help predict treatment response. Studies are also exploring the use of advanced imaging techniques to better visualize the vestibulocochlear nerve and its surrounding structures. Researchers continue to investigate the underlying mechanisms of vascular compression and its impact on nerve function to develop more targeted and effective treatments.